Rett syndrome is a genetic neurodevelopmental disorder that is caused by a mutation of the MECP2 gene. The MECP2 gene is located on the long arm of the X chromosome and plays an important role in brain development and brain function throughout one's life. Rett syndrome primarily affects females and occurs in up to 1 out of 10,000 births. Because males only have one X chromosome, they typically die shortly after birth. The average life expectancy of a female with Rett syndrome is 40 to 50 years of age. Rett syndrome causes severe cognitive, physical, and communication deficits. The first stage is the early onset stagnation period, which begins when an infant is 6 to 18 months of age. This stage is characterized by slight changes in behavior, including frequent crying, restlessness, irritability, less eye contact, and a decreased interest in play and social interaction. Most children in this stage appear to be typically developing as they learn to crawl, babble, and sometimes even are able to produce words and walk. This stage is often overlooked. The second stage, rapid developmental regression period, begins at 1 to 4 years of age and may last for weeks or months. Characteristics include loss of previously learned spoken language and the loss of the ability to make purposeful hand movements. Stereotyped repetitive hand movements included ringing, washing, clapping, rubbing, and tapping become apparent at this stage. Other characteristics include slowed rate of head growth, difficulty eating, difficulty sleeping, and difficulty breathing. Teeth grinding, panic attacks, and difficulty planning and coordinating muscle movements are also characteristics of this syndrome. Children may become more socially withdrawn at this stage as well. Stage 3, the pseudo-stationary phase, begins anywhere from ages 2 to 10 and can last for years. Some remain in stage 3 for the remainder of their lives. Characteristics include seizures, persisting or worsening breathing difficulties, difficulty maintaining and gaining weight, difficulty planning motor movements, and repetitive hand movements. In this stage, improvements in communication, including eye contact and social skills, are made, as well as improvements in behavior. Stage 4, the later motor deterioration stage, begins after 10 years of age and lasts for years or decades. Muscle weakness, scoliosis, and increased rigidity of muscles are characteristics. If an individual was able to walk prior to this stage, this ability is now lost. Repetitive hand movements may decrease, and nonverbal communication skills, intellectual ability, and the ability to make purposeful hand movements all remain stable. When working with individuals with Rett syndrome, an interdisciplinary team approach is recommended. Team members often include, but are not limited to, speech-language pathologists, physical therapists, occupational therapists, developmental, behavioral pediatricians, nutritionists, and of course the family. In regards to communication, children with Rett syndrome are typically unable to communicate verbally, have decreased eye contact, are unable to use gestures using their hands or limbs, have difficulty understanding language and learning to read and write. A delayed processing time is typical for children with Rett syndrome. Speech-language pathologists can teach a child to communicate using a variety of methods, including picture boards, eye gaze technology, computerized devices, head pointing, body language, and facial expressions. They can train caregivers to acknowledge and respond to a child's attempts to communicate, prompt communication by asking questions and commenting, and give a sufficient amount of wait time for a child to respond. To learn more about Rett syndrome and the role of other team members, go to rettsyndrome.org or mychildwithoutlimits.org.